Hello everyone, welcome to my presentation about the awareness, management, and treatment of a sickle cell patient. My name is Kaylee Lando. I am a certified clinical medical assistant and I also hold an associate's degree in business administration. I am also working on my bachelor's degree in health sciences. The topic that I am presenting today is something that I hold dear to my heart. I hold this dear to my heart because I too am a sickle cell patient. While I am speaking on the treatment and the management of sickle cell, I also want to bring awareness. I have experienced that the topic of sickle cell is often overlooked within the medical field and within the healthcare curriculum. It is usually only briefed over, and that can usually lead to some miseducation. It is rarely talked about medically and ethically. I want to be able to provide some insight that lies within those gray areas. As I provide some information, I would also love to hear some feedback from you all as well. So my goal today is to increase the knowledge about sickle cell among medical professionals in Northwest Georgia. And by the end of this lesson, I want at least 80% of you to be able to identify at least 2 symptoms of sickle cell disease. And then I would also like to be able to have 70% of you be able to create 1 treatment plan checklist for sickle cell patients. What is sickle cell? Sickle cell is an inherited blood disorder that affects the hemoglobin and that carries oxygen. It causes the red blood cells to lack less oxygen and nutrients. The red blood cell loses its plump, round shape and forms into a crescent and becomes sticky and rigid. We will go over how these physical and chemical changes contribute to the overall complication of the disease. How are sickle cells mutated? According to the evidence-based management of sickle cell disease expert panel reported by the U.S. Department of Health and Human Services, the sickle cell mutation comes from a substitution of the amino acid valine for glutamic acid at the 6th position of the beta globin chain, causing the formation of sickle hemoglobin S. These substitutions can either be heterozygous, or homozygous. Heterozygous means that the genotype comes from 2 different versions of a gene, one from both parents. Hemoglobin SS is considered a homozygous gene. Hemoglobin beta thalassemia and hemoglobin SC is considered a heterozygous gene. This missing amino acid within the chain is what causes the red blood cell to form into a sickle shape, which reduces the amount of oxygen and nutrients that get transported through the vascular system to many tissues and organs. This is a chart that shows how hemoglobin SS and beta thalassemia are similar and have some of the same clinical representations when it comes to the complications of sickle cell. They are the 2 that carry out the most episodes for vaso-occlusive crises. Also shows how hemoglobin AS, which is here, is a carrier for the sickle cell trait, and it comes with no complications of the anemia. So as you can see, this is the normal hemoglobin with the trait attached to it, and then SC is next, and then I would rate it as beta thalassemia plus would be right after, and then beta thalassemia 0 and sickle cell hemoglobin SS are the worst of the 5. Who are affected by sickle cell? Over 100,000 people in the United States and over 2 million worldwide are affected by sickle cell. People of African, European, Middle Eastern, Hispanic, and Middle Asian descent. People with sickle cell mostly can be found in countries like the United States, South America, and Africa. So in areas such as this and there, even in Japan. So sickle cell has many faces. This is a video. It just shows how sickle cell has many faces. You can't tell based off how they look.
I sickle cell?
I have sickle cell.
Sickle cell disease is a genetic blood disorder that causes red blood cells to form in a C shape, which can block blood flow and oxygen from getting to the body's tissues and organs.
This can cause severe pain and other serious health problems.
People with sickle cell disease come from places around the world like Sub-Saharan Africa, South America, the Caribbean, Central America, Saudi Arabia, India, and Mediterranean countries such as Turkey, Greece, and Italy.
You can have sickle cell no matter what you look like or where your family comes from.
Remember that sickle cell has
Many faces.
Alright, that was just a brief video that touches on the many faces of sickle cell. As you can tell from the video, many of them don't look like they may have sickle cell, but they do. Alright, so there are 5 sickle cell genotypes. There is hemoglobin AS, hemoglobin SC, hemoglobin beta thalassemia plus, hemoglobin beta thalassemia 0, and hemoglobin SS. As we know, the mutation of the hemoglobin is what causes the abnormal hemoglobin, hemoglobin S. There are 5 different types, as I just stated. These 5 genotypes determine the nature and the severity of sickle cell disease. A normal hemoglobin is hemoglobin AA. Both alleles for hemoglobin AA show no signs of sickle cell anemia and are not carriers. Hemoglobin AS does not have a normal adult hemoglobin and has a sickle hemoglobin. Hemoglobin AS is considered as normal and are unlikely to show symptoms of the disease. Hemoglobin AS carries a normal allele for hemoglobin A and an allele for sickle hemoglobin S. With this genotype, people can pass down the gene to their children, and it is very rare that this genotype will show symptoms of the disease. Hemoglobin SC does not have a normal adult hemoglobin and has a sickle hemoglobin S with a variant of the hemoglobin C. This genotype can be found mostly in people of Mediterranean and African descent. With hemoglobin SC, milder complications of the disease are experienced, and they are likely to experience splenomegaly, which is the enlargement of the spleen. Hemoglobin beta thalassemia plus has 1 allele for hemoglobin S and 1 allele for the form of beta thalassemia plus that has some parts of a normal hemoglobin. This genotype is less severe compared to hemoglobin SS, but people with this genotype can still experience some pain crises and anemia. The severity is based on the amount of normal hemoglobin present. Hemoglobin 0 has 1 allele of the hemoglobin S and 1 allele for a form of beta thalassemia 0. That does not have any parts of a normal hemoglobin present, like hemoglobin beta thalassemia plus would. This genotype tends to have more complications and similar symptoms, and is just as severe as hemoglobin SS. Hemoglobin SS is the worst of the genotypes and is the one called sickle cell disease. This genotype has 2 alleles of hemoglobin S, that one comes from each parent. Individuals with this genotype experience incredibly severe pain crises, various complications from the amount of sickling, and severe anemia, have higher risk of organ damage, stroke, and infections. So here, as you can see, hemoglobin AS and hemoglobin beta thalassemia plus hold normal adult hemoglobin that carries the sickle cell gene, and they do not experience vaso-occlusive crises. Hemoglobin SC, hemoglobin beta thalassemia 0, and hemoglobin SS do not carry normal adult hemoglobin and has a great amount of sickle hemoglobin attached. They do experience more vaso-occlusive crises. What is a sickle cell crisis? A sickle cell crisis, also known as vascular occlusive crises, gives rise to extreme pain episodes that usually can come about suddenly. It is caused when the sickle red blood cells that are rigid and sticky get stuck in small blood vessels that can block blood flow. The blockage can deprive oxygen from the surrounding organs and tissues and cause pain and possibility of damage. It can cause extreme pain in areas like your joints, your back, your chest, your abdomen. These crises can last from hours up to days, and sometimes it can last weeks at a time. These crises can be triggered from stress, dehydration, overexertion, extreme temperatures, and changes in altitude. So if you go flying in a plane, sometimes that can trigger a crisis if you're not prepared, if you're not well hydrated before you go. Or if you are working out and you do too much and you overexert yourself, you can trigger a pain crisis then also. And that leads us into what trigger a pain crisis. As I stated before, dehydration, high and low altitudes, stress, strenuous activities such as anaerobic exercise, so exercises that does not involve oxygen, extreme temperatures, extracurricular and social activities such as smoking, vaping, and drinking. It is important to educate your patients about trying to have a serene life as much as possible to avoid the possibilities of triggering a sickle cell crisis. They should always stay hydrated because it helps with the production of red blood cells and keeps the red blood cells plump and firm and lessens the chances of them sickling. Making sure that they are dressing for the weather. So if it's extremely cold outside, they need to always have on multiple layers of clothes. If it's extremely hot, they need to always make sure that they are staying hydrated in extremely hot temperatures, but also wearing appropriate clothing is important. Limiting extracurricular activities such as smoking, vaping, and drinking, because smoking and vaping and drinking can take away the oxygen within your blood system, which can cause damage and affect the red blood cells because they're not getting oxygen because you are smoking, drinking, or vaping. All right, notable objective signs of crises. So basically ways that you can tell that someone is in a crisis. Excessive crying, moaning, and rocking. Inability to stay still. Weakness, like they can't stand on their 2 feet. They're having a hard time walking. Fetal position. Sometimes the pain can get so bad that they end up in fetal position. So you know how a little newborn scrunches up? They can scrunch up in fetal positions because of the pain. Respiration rates of 25 beats per minute or greater, so they're breathing extremely fast because of the pain. Inability to speak clearly or at all. Limping, and the limping comes with with the reasons for lower extremity pain mostly. So these are signs that you can help determine, and you can physically see that they are in pain. Common complications. So sickle cell comes with multiple complications, unfortunately. Complications such as chronic pain, acute chest syndrome, stroke, renal failure, cholecystitis, which has to deal with your gallbladder, splenic sequestrian, which is your spleen, retinal complications, so problems with vision, pulmonary hypertension, so having high blood pressure. Acute chest can come about suddenly and give chest pain and respiratory symptoms like shortness of breath, wheezing, and hypoxia, which is, low breaths or low oxygen. So the blood cells aren't getting oxygen. Stroke is caused by blockage in the vessels to the brain. The sickle cells and the amount of hemolysis can cause damage to the kidneys, the spleen, and the gallbladder. A good majority of sickle cell patients are living without their gallbladder, and some are even on dialysis because of the attacks of the blood cells. All right. some treatment options. There are many treatment options that help with managing sickle cell. One of the treatment options is hydroxyurea. Hydroxyurea can reduce pain occurrences and acute chest syndrome. It's something that they take daily. The dosage does vary based on the physician. It helps to bring about fetal hemoglobin and helps to lessen the amount of sickle red blood cells. Folic acid, it helps with the production of new red blood cells because it is a B vitamin. And it lessens the amount of hemolysis that takes place. Advil, also called crizanlizumab, is an intravenous monthly treatment. It's a monoclonal antibody that blocks a protein that's involved in the formation of the hemoglobin S and targets the P-selectin. It also reduces the amount of sickle cell crises. Controlled pain medications. Controlled pain medications control the severity of crises. So doctors may place patients on things like ibuprofen 800, Percocet, or Tylenol 3 to help manage their pain at home. It is always encouraged to manage pain at home first before going to the emergency room. It's only then when you are not able to manage your pain at home when it is okay to go to the emergency room, because clearly the pain has gotten worse and the meds at home are not working. So ibuprofen 800, Percocet, Tylenol are typically used for controlling the pain at home. And things like in the hospital, Dilaudid, morphine, and Demerol can be used for pain while hospitalized. Dilaudid is what typically is more effective for some sickle cell patients. I personally feel like Dilaudid is the only thing that helps me. Morphine doesn't do anything, doesn't reduce my pain, it just makes me high. And then I am allergic to the other one, Dilaudid. I'm allergic to Demerol, so I can't take that at all. Another good thing for treatment is blood transfusions. So blood transfusions are needed once the hemoglobin levels reaches the level of 7 or less, because then those are kind of like fatal once it gets below a 6. So it's important to do blood transfusions, but it's not good to always have multiple blood transfusions within a year. According to my doctor, sometimes it can cause hemochromatosis, which is an increase in iron. So you go from being anemic to highly possessing a lot of iron in your body. And it can be a cause from the blood transfusions. Intravenous sodium chloride infusions, they help to increase hydration. So while patients are hospitalized, it is encouraged that they are getting an IV fluid so that they can get some hydration in their bodies to help pump up those red blood cells and lessen their crisis at the same time. Options for cure. So there is no definite cure, but studies have shown success in a few clinical trials for curing some patients of sickle cell disease. So bone marrow transplant has been used for years. It has a 95% survival rate 2 years after transplant, and 88% considered cured with no disease-related events, according to my sources. This is one of the less costly options for cure with higher success and engraftment rates. Gene therapies is something that is kind of new within the last 10 years, but it is used with the use of CRISPR, which is a clustered, regularly interspaced, short palindromic repeats. That is a gene editing technology. One of the few options of this CRISPR that uses gene therapy is Casgevy. It uses the patient's stem cells. So, and also leukemia, they both use the stem cells of the patient, and the stem cells of the patient are taken from them. They do undergo like chemotherapy, and they do have to have long hospital stays before they're able to get their gene edited stem cells back. And once they get their gene edited stem cells back, they are transfused back to them, and then they are staying in a hospital for additional observing. So they're being observed for typically like months at a time after their transplant for the gene. All right, there are many, there aren't many places where you can go for treatment of sickle cell. I only know about the ones that's in Georgia, so there are treatment centers here in Georgia. And there is a limited amount of them and a limited amount of hospitals that know how to deal with sickle cell patients in the United States and in Georgia. Places that can treat is mostly oncology, hematology centers that have practitioners that have experience with treating sickle cell disease. Georgia has some of the top treatment facilities, such as the Sickle Cell Clinic at Grady Memorial, which is in downtown Atlanta, Children's Healthcare of Atlanta for pediatric patients, Augusta University Sickle Cell Center, and then Georgia Department of Public Health. They're able to give you the resources that you need to find treatment and to find like your doctors. All right, sickle cell patients not only deal with physical pain, but also mental, psychological, and emotional pain. Examples are stress, depression, anxiety, and insomnia. In social interactions, they sometimes have difficulty forming friendships and relationships because they feel as if nobody understands, they feel some patients can feel like it's a burden on their family and friends having this disease, because they do go through a lot. And so they get depressed, they have anxiety, they have trouble sleeping because of all this thing. And the insomnia comes from being up multiple nights because of pain. So going through a pain crisis, you can't sleep because of it. Discrimination and unfair treatment. So sickle cell patients have a bad stigma placed on them by healthcare workers. Sometimes healthcare workers label them as bad patients. They are subject to bias and discrimination based on cultural, historical, and social factors. They are perceived that sickle cell only affects African Americans when it does not. It also affects Asians and also affects people of the Mediterranean descent. Southern Europeans, as we did go over at the beginning of the presentation. It affects many people, and all of them do not look the same. Severity of crises are overlooked due to the frequent visits to emergency rooms. So they are often labeled as drug seekers or addicts because they have a constant need for narcotics in a painful pain crisis. Because again, they start their treatments at home when it comes to their pain. They try to manage it at home, but once they're not able to manage those crises and that pain at home, then their only option is to go to the hospital. Sometimes there are frequent flyers. There are people who have more pain crises within a short amount of time than others. It doesn't necessarily mean that they're seeking for drugs, because trust me, they are not there to seek drugs. They are there to get help because the help they had at home is not helping. They want help, they want understanding, they want people to understand how they feel and understand that they are in pain. They may seem difficult, but they're not, because that also goes back to how you can tell they are in pain. Like, you can tell by their your objective view of them, by seeing how they are. You see that they are scrunched over, you see that they're moaning, you see that they are crying, you see that they are limping or in fetal position because they are in extreme pain. Sickle cell patients have this bad stigma, but it shouldn't be that way at all. It really shouldn't, because cancer patients also have pain, and cancer patients also don't get the same discrimination as sickle cell patients who have to deal with this pain all of their lives. There is not a cure. Most of them do live with it for the rest of their lives. All right, promoting healthy living. As a medical professional, there are many ways you can promote a sickle cell patient to stay healthy. Promoting things like talking to their promoting things like taking their prescribed medication daily, such as their hydroxyurea, folic acid, their multivitamins, and any other vitamins that they need to stay healthy, just in case they have a decrease in a certain vitamin. Dressing for the weather, as I stated before, multiple layers of clothing in the colder season is permittable. They need to be able to cover up in the winter, to avoid, crisis. Attending regular checkups, infusion appointments, PCP, hematologists, etc. So making sure they're staying on top of their appointments, not missing any of their appointments, not missing any of their infusions. And I'm sure that most of them go to a hematologist, and the hematologist is the one who put those infusions together, who gives them their daily medications such as hydroxyurea, and who also puts them on folic acid. Most PCP, from my experience, they will see the sickle cell patients, but because they feel like the hematologist controls and does all of their blood work and is controlling the disease, then they feel that they aren't needed unless they are needed for a physical. Encouraging good hygiene, such as washing their hands all the time. So making sure if they're around anybody sick, they're washing their hands frequently, or just washing your hands after going to the restroom, touching multiple things, because you never know what anybody's touched, and they are very prone to getting infections and disease from others. So yes. All right. And also daily hydration, healthy eating, and exercise. Encouraging them to drink 8 to 10 cups of water daily, or just staying hydrated, period. Having just a little bit of exercise, being able to walk a couple miles a day, nothing extreme, nothing strenuous, and being able to eat healthy. So try not to eat as much heavy foods, because it can lead to high blood pressure, and then high blood pressure also is a complication of sickle cell, and that's just not a good combination. All right. Ways to treat as a medical professional. Ways that you can treat and do your plan of care is increase the need for IV fluids, especially when they are in the hospital. So on this slide, I am basically describing ways you can do your plan of care based on a hospital stay, so based on admission. So an increased need for IV fluids is needed. They need to stay hydrated, so having them on continuous IV fluids will be good. The use of a PCA pump, which is a pain management pump. It is stated, there is a study about the use of a PCA pump in the emergency room. A lot of hospitals do not start their PCA pumps or meds like Dilaudid in the emergency room, and it is a study that shows that it is useful into maintaining and lessening the crises and for how long the crises last, and lessening their hospital stay. So possibly implementing a PCA pump and trying to get it started in the ED before they make it to the next level of the hospital, before they make it onto the floor. If they have high rates of elevated leukocytes, implementing IV antibiotics, whether IV antibiotics or oral antibiotics. You just want to make sure their leukocytes gets down, because it could be a sign of infection, of course. Blood transfusions, implementing blood transfusions if you see that the hemoglobin is reaching below 7. Once it gets below 7, it can be critical, and it can also be critical once it gets below 6, and you never want it to get that far. So being ahead of the game, pain and starting blood transfusions is a good idea. The use of an incentive spirometer, it helps decrease the risk of acute chest syndrome. As we stated before in previous slides, acute chest syndrome can cause symptoms like wheezing and chest pain and low oxygen, trouble breathing, shortness of breath, things like that. So the use of a incentive spirometer keeps those lungs and airways open. Blood collection. You will also implement, round-the-clock blood collection in order to monitor the blood chemistry levels, making sure that the hemoglobin is getting back up to where it needs to be or staying where it needs to be, making sure that you're not finding any leukocytes in their blood or anything else of concern. Encouraging ambulation, so encouraging them to get up and walk around. Some will stay in the bed because of the pain. And it's understandable, they're in pain, they don't want to move, they can't move, especially if they're having like pain in their lower back or their legs. So encouraging them to get up out of the bed and walk around the hospital room or walking around the clinic, in whatever medical setting that you're in, just try to encourage them to keep moving, because sitting still too long eventually makes them tense up. And finally, how can you help? Socially, emotionally, you can help by showing empathy. It is always important to show some empathy. You were taught this in medical school. You were taught this when you're training to be a registered nurse. You're taught this when you're learning to be a medical assistant, a CNA, all the above, to show empathy. You don't have to sympathize, but you need to show some type of empathy. Show that you care just a little bit. Talk to the patient. Sometimes they need someone to talk to them. Some prefer if someone talks to them, especially when they are in pain. Understand them without judging. So try to understand where they're coming from. Try to understand how they're feeling. Try not to judge them, especially based on their race or their religion or how they look. Just try to understand them and understand their pain. Encourage having a support system. I feel like that is very important with sickle cell patients, is to have a support system with family, friends, close, because sometimes it can get lonely for them. So if they're lonely, it leads to anxiety, it leads to depression, things like that. Encourage them to have that support system because it is very important for their mental health. Providing resources. So providing resources like HSCI, like sending them to, basically having a patient advocate available for them. If they need help with food or maintaining or getting food supply, try to get the patient advocate to find resources for food drives. They're having trouble with their insurance, or they've missed work multiple days and things as such. Try to get them help with SSI or SSDI, depending on their age and depending on their work history. Financial support, they are stating they're having financial struggles because of their time away from work, because they're having to go in and out of the hospital and having to miss work. Some may not have disability or FMLA set up for them with their work. So try to help find them support financially, give them some resources, and then also encouraging them to go to therapy and support groups. I know at the Children's Healthcare of Atlanta, they do have support groups for the pediatric patients. I think they do also have support groups for adult patients at Grady, and Grady also provides like a little folder booklet with resources. They also have like a therapeutic place for sickle cell patients to go to get like massages and relax. It's like a mini spa that is free to them. So if you would like to look that up, that would be great. So that is the end of my PowerPoint and my lesson. Is there any questions that anyone would have or would like to have? If not, You know, you can reach out to me if you have any additional questions. You can provide feedback. Feedback is always great to have. Thank you for coming to my lesson. I appreciate you all for listening. Have a good day.